Hi, everyone. Welcome to this webinar sponsored by Resolve, the National Infertility Association. Today, we're going to hear from two experts, Alice Domar and Sharonda Scott Osborne of Boston IVF, on how to cope with the news that your cycle is postponed. We're very pleased to have these two experts with us today. Just a reminder, Resolve is a nonprofit organization that is a national organization for anyone who is trying to build their family. We provide support, advocacy, public awareness, patient education, and information on infertility, as well as all the different ways that people can build their family. You can get and connect with Resolve through a variety of social media platforms, Facebook, Instagram, Twitter. You can also join our online support community, which is through inspire.com. And you can also go to our website and find out about support groups that are in your local community. We have a number of ways to connect and to get support through Resolve. I'm now going to turn this over to Ali Domar, who's going to share with us some tips on coping with the news. Ali?
Thanks, Barb. I think this is an unprecedented, extremely challenging time for pretty much everybody in the world, and certainly everybody in the U.S., and sort of more immediately, people who are struggling with infertility. And, we at Boston IVF yesterday were told that we had to postpone cycles for at least a month. And so I've spent the last couple of days talking to my patients about what that means and how to cope and how not to get upset about it. And there's no question, it's really challenging. Nothing like this has ever happened before, but I think we all need to sort of rise to the occasion and learn how to handle news like this and how to thrive. What I've been telling my patients is, what we were told yesterday is we're hoping this will only be for 30 days, and that we can get the situation under control and be back up and running in 30 days, and that would be wonderful. Hopefully that's true. And I think that there are a lot of things one can do while you're struggling with this news. One is to put it in perspective that, delaying a cycle for 1 or 2 months is not going to affect your chances of getting pregnant. Fertility rates just don't plummet in 1 or 2 months. And what I've been telling my patients is I think you can take that month or two and think about how can you make yourself as healthy as possible during those 30 or 60 days? Because, I've spent my whole career, it's like 33 years now, trying to convince my patients to exercise moderately and to do relaxation techniques every day and to eat healthfully and to do all the things that we know are going to make you feel physically and emotionally healthier. And what I'm always being told by my patients is they just don't have time. Well, you know what? For the most part now you do have time. And so this is a great time to learn all the things that you can do to get you in the best possible physical and psychological shape for when you do start your cycle. I would definitely try to do moderate exercise on a daily basis, whether it's, what I recommend to my patients is walking is the best exercise there is. It's the absolute best way to treat stress. That'll make you feel physically and psychologically healthier. And so if you can take an hour walk every day, I'm not talking about like running after a lab. I'm talking about, brisk walking, maybe the speed of a relatively fit basset hound. And so just try to walk for about an hour every day. This is also a great time to either start learning relaxation techniques or to refresh your ability to do relaxation techniques. There are lots of ways. You can either download the apps I help co-write, Fer2Calm for women or Fer2Strong for men, or there are lots of apps you can get online like Calm, Headspace, Insight Timer, and all of these have scripts where you can literally just turn on your phone and a voice will guide you through a 10 to 20 minute relaxation. And if you can do a 10 to 20 minute relaxation at least once and hopefully twice a day, you're going to find yourself feeling more relaxed for that period of time. But after a week or two, you're going to get what's called a carryover effect. And you're going to start feeling more relaxed and less anxious throughout the day. We also teach our patients, and it is on the apps, what we call mini relaxations. And there are 2 times when you can do minis. One is when you realize you're anxious. You know, you watch the news and it makes you anxious, and that's a good time to do a mini. Anytime you feel anxious, just do a mini. And the other time to do a mini is, you know, to start identifying what situations which push your button and do a mini ahead of time. So I think if you can try incorporating daily exercise and daily relaxation techniques, you're going to physically start feeling a lot better. Other things that you can do, especially if you're working from home, is make a schedule for yourself. You know, I've done a lot of Zoom sessions with patients this week, and they're literally in their pajamas, not showered, hair in disarray, and it really would be, oh, sorry, that's my dog. That's still my dog. It's a lot better for you if you stick to a schedule. So get up at the same time every day, shower and dress, and, you know, write down your schedule. You know, from 9 to 10, you're going to do this, and from 10 to 11, you're going to do that, and just do that throughout the day. And that's going to make the day go by quicker, and it's going to make you feel less anxious. And finally, I think all of us need to really restrict how much time we spend watching the news, watching reports about the virus, because there's a lot of sensational stuff going on out there. And if you can, look for the good stuff. I mean, there's some really good stories coming out about people volunteering their time, restaurants donating food. You know, try to look for the you know, the silver lining of the cloud that we all feel like we're under.
Allie, thank you so much. Really, really fantastic advice, and I do hope people download that free app, FertaCalm, C-A-L-M, and then Ferta Strong. So the FertaCalm is for women, and the Ferta Strong is for men, and you'll find that in your app store, and they are free apps. Really great resources. Thank you, Allie. I'm now going to turn this over to Sharonda. It's an important time, and I think you probably have some suggestions for patients and people who are going through this on things that they could think about asking their healthcare provider. So maybe you could share that with us now.
Sure. Thank you, Barb. This is a very difficult time, yes, like Allie mentioned. Having your IVF cycle canceled or delayed can be heartbreaking, as patients have invested their time and emotional energy. So it's, you know, a difficult time, yes, but please be sure to recognize, you know, as the patient that your team, your nursing team, your physician team are wonderful sources and are there to help you understand the cancellation or postponement process. So I do recommend reaching out to the team and ask questions such as how often will updates be communicated and where can this information be accessed? Are you utilizing the fertility company's website? Will the physicians be using social networking sites? Those are all good questions to ask. Who will be their point of contact during this time for questions, whether that's nursing, whether it's physician or administrative? That's another question that patients should definitely speak with their team about. And then for those who've not begun cycling, so it's just been postponed, this may be a good time to reach out to the teams to discuss questions that may not have been asked in prior visits that may have come up since seeing the physician. So I know a lot of our physicians here at Boston IVF have moved into telehealth as far as contacting patients. So that would be something that patients could definitely ask their teams, okay? And then for those who've started their IVF cycles and have been canceled, please talk with your physician and team about how the cycle went up to that point, you know, up to the cancellation point, what things were going well, if the physician had any recommendations for any changes. Also discuss the questions that they, as patients, may have developed during the cycle but may not have been able to ask. Other questions to ask, since you've had the cycle canceled, how to store the medications that you have on hand already, whether they're opened or unopened. And in both cases, please ask your teams what recommendations they may have for you during this time between cycling, such as nutrition or exercise. And it's important to listen to the recommendations and take the time to emotionally process the experience up to that point and the information.
Thank you so much. I also just want to add, this is Barb again, with telehealth, this is where you are interacting with your healthcare provider or even a mental health provider remotely. And so that could be via a Skype or some sort of video conferencing or over the phone. And my understanding is that oftentimes this telehealth is not covered by insurance. However, because of the state of emergency that's been declared in most states and nationally, healthcare insurers, so your insurance provider, is most likely now covering telehealth. So please check into that. Both Allie and Sharonda mentioned telehealth. It'd be a great time to check in with your insurance provider, even if they don't cover IVF, to see if maybe telehealth mental health visits or even telehealth visits with a nurse or somebody else at the clinic may actually now be covered by your insurance. So definitely check into that. Ali and Sharonda, any last thoughts that you'd like to share?
Yeah, I was going to add, Barb, I think, certainly in Massachusetts where there's a state of emergency because of that, I, as a psychologist, can now do sessions via Zoom, which are now covered by insurance during the state of emergency. And our physicians are able to do telehealth also that are covered by insurance. So I don't know if insurance companies and IVF centers' websites are necessarily current because everything changes day to day. So you may want to call your infertility clinic or center and or call your therapist and see if they are now able to do telehealth. I also found out this morning that in some states, they are allowing mental health providers from out of state to provide telehealth counseling. There aren't that many mental health professionals who are experienced in reproductive medicine. And so there are some states that, for example, I actually don't know the laws for Massachusetts, but there are some states now that, let's say you live in Wyoming and there are no mental health professionals who are well-versed in reproductive medicine, there might be someone, for example, from California that you could do a Zoom session with that would be allowed.
Excellent information. Sharonda, any last thoughts?
Yes, I would just like to say, please stay healthy during this time. Reach out to your support team, whether that's friends, family, or your physician team. Please reach out for positive support and stay healthy and optimistic. So healthy, emotionally, physically, everything. Wishing everyone all the best.
Well, thank you both so very much. Please go to resolve.org. We have resources that we are up. If you go to resolve.org, on our homepage, you'll see the link on how to find those resources. Check us out on social media. We have an online support community. We have support groups that are now going to be meeting virtually all over the country. So reach out. We have tremendous ways to connect and get support during this difficult time. Thank you all so very much.